Hello friends, I am Dr. Sandeep Bhasin from Carewell Medical Center. Today I'll be talking about how we do hair transplants in special population, especially patients like Africans, the Negroes. The problem with African and Negroes is it is very difficult to do FUE because their hair are very curly. If we try to extract their graft, there is a lot of transaction and damage to the grafts because it is very difficult to know the direction of their hair. In this video, I'll be showing you the technique that we use, that I am using to do hair transplantation in the Negroes and people with curly hair to get very good graft and with very less damage. The another problem that we face in these patients is that the bleeding is much more than the normal population. So today I'll be showing you the technique how we do hair transplantation in African patients and Negro patients. There are many centers which refuse to do FUE in these patients and they say only FUT can be done, and FUE cannot be done in Negro patients. But I'll be showing you how we do it. So here we are doing extraction on this patient using FUE. So what I want to tell you is the technique that we use here is, because the hair are very curly hair, we are moving our probe, giving an internal movement like a C. When we go inside, we tilt our probe slightly in angular direction, keeping the C shape of the graft in the mind. So this movement of the probe when we go inside is very important to get the grafts without damaging them. So as we go in, the probe is turned at a greater angle as if we are curling it inside. So I'll be showing you how the grafts in such patients are there. You can see the grafts are very curved. They are like C-shaped graft. They are like curved in a shape of C. They are not straight grafts. This is very important that we have to keep. Their internal angle and the exit angle is very different. So when we take our probe inside, we have to follow the direction of the graft. We make our angle more acute when we go inside. And you can see we have got the grafts without any damage to the roots. The roots are there. So now we are giving anesthesia in the front and we're giving the block in the front in the recipient area. This is just like we normally do with other cases. So this step is very similar to our normal transplant. And then we are giving Tumesence in this area and the recipient area. The front line that we have demarcated in this patient, we are making it clearer with methylene blue. This is the Tumesence to decrease the bleeding. And now we are making holes using 18G needle. So we are doing these holes with this 18G needle. We are giving a moderate density. We have got about 2000 grafts to be implanted in this area. So you can see these holes that we have made with moderate density. And now we are implanting these grafts using no root touch technique. We are maintaining a good hydration, constantly putting water so that our grafts do not get dried up. It's very important that we do not touch the roots while implanting to improvise the results. And we're using the no root touch technique. So this is how we do hair transplant even in difficult patients where most of other centers would refuse to do a few hair transplant, and we have taken such patients to do hair transplant in Kerwell Medical Center. These are the final results that we have got with transplanted hairs grafted with the grafts that we implanted here. And this is the donor area. We are doing the dressing now, applying the antibiotics and doing the coverage with dressings. And here are the photograph with the patient after the surgery.